Greetings, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Michelle Guadalupe, Advocacy Alliance Development Director for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on step therapy in Missouri. But what do those victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their new rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in Missouri that was fully implemented in 2018 and what to do if you feel the law has been violated. First, let's define step therapy. It is a protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the Missouri legislature on the step therapy bill, and a huge thank you to each of those legislators. So now that there is a law in Missouri on step therapy, we want to make sure that you know what that means. The law ensures access to a clear and timely process for requesting an exception, and a patient won't be required to go through step therapy if they have tried and failed a drug, either with their current or former insurance provider. Who benefits from this new law? Patients who have state-regulated health plans are the ones that benefit from this law. Self-insured plans, where benefits are paid directly from the employer and the health plan acts as just a claims administrator, are subject to ERISA and generally are not subject to state insurance law. To learn if you are covered, contact your insurer and provide your policy number. What if your prescription is denied? If your medication is denied because of step therapy, your insurance won't cover the prescription. At this point, you may want to talk with your pharmacist and healthcare provider about alternatives that would be covered. You can also decide to pay out of pocket and compare discount cards, cash prices, and assistance programs to determine what works best for you. Many of us will realize that with the new law that we should actually start the appeals process in the matter. So we wanted to give you some helpful tips on doing so. You should ask your pharmacist what they heard from your insurance company and make sure to write it down. Contact your doctor and report the problem. See if they can suggest next steps for you to get your medication. You should also call your insurance company and find out how to appeal the decision. Your physician often needs to intervene and write a letter. Share copies of any insurance letters or information you receive with your doctor, just wanting to make sure that you both are on the same page. Another good tip to do is to check with your human resources office to learn specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. And then again, if nothing has worked, you may need to appeal the insurance company's decision. You can call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeal needs to be online or if there's another process from your insurer. As with when you're talking with your pharmacist and your doctor, you're going to want to keep notes of all conversations with your insurance company, who you speak with, dates and times of calls, case reference numbers. Having those good records will help move future calls forward. Stay in touch with your doctor through the process and make sure you share information. Your insurance company must provide a reason for your denial in writing. Ask about it if you have not received anything. If submitting an appeal yourself, include all relevant documents that may help your case. This includes letters of support from your physician, test results, and your personal narrative. What would be the next step, though, if your insurance company is not compliant? This is where the insurance department comes into play. So what we've done is we've provided you with a website and phone number for the Missouri Department of Insurance. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. the Department of Insurance want to hear from patients, and they want to hear these different complaints. They are there to help. So please make sure that you have that information before you make that phone call. If you have any questions or need additional information, all our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit your Coverage and Care through the Prescription for Access project. This go-to resource will help you better understand healthcare coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claim denial process. The kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. The kit also includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeal process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar, as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections. Thank you.